or other herbal medicines as well. So I think, Dr. Aparna, I would like you to introduce yourself as well. And I really want us to have this as a really practical session, so I wouldn't take much of your time. Thank you for joining us.
Yeah. Thank you, Natasha, for having me over. This is my second session with you guys, and I've really enjoyed sharing something that I'm really passionate about on a bigger platform. I am Dr. Aparna Kamulkar. I am the founder and clinical director of a practice called Prana Thrive here in Central New Jersey. And my practice offers in-person, virtual, and hybrid sessions for anything related to the pelvic floor. My practice treats women, but also treats men and children. They also have pelvic floor issues, and it's an inclusive practice. We treat all genders and ages. I don't want to, and that's a quick introduction about myself. If everyone's here, I would like to jump into what we're doing this session so we have enough time. And I'm gonna, just to give you a little agenda, I will be starting with a little bit of a lecture format, a short information about why we are doing why we focus on breathing and its role in the management of chronic pelvic pain. And then once we do that in about 10-15 minutes or so, we're going to switch to actually doing stuff together. So be comfortable in your homes, wherever you guys are. You guys could just either watch me, or if you feel comfortable, you guys can start actually join me in doing the exercises and the activities that I will be sharing with you guys. Okay, and I will be around after the lecture for a few minutes. So even if this is mainly based on breathing, but if you ladies have any other questions, I'm here to answer them. Okay. So I'm gonna share my presentation. Um, Give me 1 second, please.
No worries.
Okay. Is everybody able to see?
Yes, Dr. Aparna, we can see it.
Okay. All right. So we're going to start with what happens when anyone is struggling with chronic pelvic pain, and endometriosis comes under that umbrella of chronic pelvic pain. This information is actually relevant to anyone struggling from any other chronic pain as well, not necessarily chronic pelvic pain. We will be talking more about pelvic pain today because we have an audience that is living with endo pain. But just for your information, for anyone that is not, know that whatever we will be learning and practicing is also extremely helpful in any kind of chronic pain in the body. So what happens, give me, like, in your chat messages, if you have been dealing with chronic pain and you've been told that it's all in your head, or just relax and you will be fine. Can you guys give me a me too in your chat for a quick second? Yeah. Yes, so it's sad to see so many people deal with this situation, honestly. But that's why I think the most important thing to do is really learn what's happening in our body. And in when we know what's going on, we are in a better situation to deal with it and work around it and find resources and do the right thing for our body. So thank you to Natasha and Eamon and She Deserves Care and organizations like these that are really helping people with endometriosis or chronic pain find the resources that they would benefit from. Okay, so basically, in any person with chronic pelvic pain, I'm gonna repeatedly say chronic pelvic pain, but know that it's for any chronic pain. What happens in your body is that you basically there's an alarm system in your body. Okay, imagine it like a smoke alarm in your body. Um, Initially, that smoke alarm gets turns on with the real inflammation that's happening. So, for example, in patients with endo, the actual endo or the actual inflammation or the actual tissue damage that has happened because of the disease process, that alarm system turns on with just that. But what happens eventually is, over a period of time, when your body endures pain and pain situations again and again, this alarm system becomes extremely sensitive. And what happens is, even it's like an alarm system in your house that goes off just when you make a toast or somebody is having a shower in the house and the alarm system goes on. So basically, that alarm system in your brain becomes extremely sensitive. And then anything and everything can set it off. Anything, slightest situation like sitting for 20 minutes can turn on the alarm system. And then your whole body goes into this fight and flight response and really starts hurting, right? So this thing about the chronic pain is that not the pain is real. Okay, the pain that's happening in your body is absolutely real. But the good news also is that we can use certain tools and techniques to desensitize that alarm system so that you are better able to deal with what is happening in your body. Okay, so what happens when a person is in pain? When you endure pain because of any reason, your body kind of goes into a fight and flight response. So basically, what is happening is that your brain tries to protect you from that pain, and in an effort to do that, it it makes your body and your muscles and everything in your organs, everything to guard and not move at all. And then that guarding or tension causes more pain, right? So it becomes like a vicious cycle. It becomes a vicious cycle of pain and then guarding, and the guarding leads to more pain. Pain leads to inflammation. It becomes like a cycle. So how breath work is one of the tools that we have. It's a very effective and it's very evidence based. There's been hundreds of research papers that have shown that breathing can help you in management of chronic pelvic pain. So in spite of it being a very non-invasive, and it sounds like a holistic tool, but honestly, it's one of the most effective tools I have seen in my practice work. So every patient that comes to me, I start with breathing. Okay, that is the thing, that is the place where I start at. And breathing, what it does is, it, like we spoke about the alarm system, it helps us desensitize that alarm system. It helps us recalibrate that alarm system in our body so that every little trigger doesn't put our bodies in a fight and flight response. Okay, it helps us get our body come out of the fight and flight response. It creates a sense of safety. It calms our nerves down. So in any kind of chronic pain, this would be a very, very effective tool that anyone can use to deal with the situation and improve the perception of chronic pain. Now, any kind of breathing exercise is actually helpful in chronic pain. So you guys might have heard of something called pranayama. It's a whole segment of yoga which actually focuses on breath work. There's so many different breathing exercises, and honestly, all of those are useful. But when it comes to chronic pelvic pain, I feel I have learned from experience, and there has been research that when you do the 360 degrees breath, which is what I'm going to teach all of you, it is even more effective. All right. I'm going to give you a quick anatomy lesson. It's going to be very quick. I don't know how many of you know that there is a muscle called diaphragm that exists in our body. So diaphragm basically sits right under your rib cage. So if this is my rib cage, diaphragm is a flap-like muscle that sits right underneath it. And then, are you guys able to see what's on the screen?
Yes.
I'm just demonstrating it. Your pelvic floor is at the bottom of your pelvis. And in between is your abdominal canal right here, where all your organs are. So your uterus is here, your bladder is here, your liver, your intestines, your colon, everything sits in this abdominal canal. It's called the visceral area, where the viscera or the organs are located. Okay. Now imagine this is your diaphragm. This is all inside your body. I'm just placing my hand here so you know the approximate position of the diaphragm. But every time you take an inhale, every time you breathe, the diaphragm is supposed to, I'm saying supposed to because then we'll find out what happens when we have faulty patterns developed in our body. But what is supposed to happen is this diaphragm moves down. It puts a little bit pressure on the organs that are sitting here in the abdominal canal, and then it allows the pelvic floor to gently relax. Okay, so the diaphragm and the pelvic floor work in synchrony, almost like a piston, and on the inhale, go down. On the exhale, they come up. Inhale, go down. Exhale, they go up. Okay, so that is what is the normal physiology that happens in the body. Now, can you guys take a guess how many times we breathe every day? Put it in the comments if you have any guesses.
1,000,000 times.
That's a bit too much, but we breathe about 20,000 times in a day. Okay, so 20,000 times we can either have a situation where everything is really happening the way it should be happening, or 20,000 times we can also be in a situation where that diaphragm is stuck, it's not moving properly, and because of all the other pain situation that is going on in some people's body, the diaphragm doesn't move, the organs don't move, the pelvic floor doesn't move, and then there's a lot of guarding and tensing up in this area, in the abdominal area and in all the organs. Okay, so how we choose to do it is in our hands, and that's why your breathing can be such an effective and really useful tool in bringing this more towards normalcy. Right?
Dr. Aparna,
Yeah.
just one question before we
Yes.
go ahead. You can
Yeah.
go back to the screen.
Yeah.
The inhale, exhale. So usually when we inhale,
Yeah.
like when I inhale, it's the opposite for me. Like it's going up, and then exhale is going down. So yeah.
Yes. Natasha, if I could make $1 with every time I heard this statement from my clients, I would easily take a vacation to Hawaii with that money. I'm not even kidding. Everybody that I treat, everybody, like I said, I start with breathing, and everybody says, oh, like, I don't think that's happening in my body. I don't think, are you confused? And I have to tell them, No, absolutely not. I am not confused. It's the patterns that our body get into, and it is the wrong patterns that our body get into that we should, we can change. Okay. We are right after this. So yeah, answering your question, Natasha, we are coming to that. And yes, everybody carries that perception because we have learned to breathe like that. But when you see a simplest thing to do is to watch a little baby, uh, an infant who's sleeping, right? If you watch the infant sleeping, you guys, you will notice that every time you inhale, that infant's belly goes up and it expands, and when they exhale, it just falls down like a wave. Okay. You keep this in mind and observe this another time when you are able to be with an infant, and you will see how the when we inhale, the belly rises, and when we exhale, it comes down. So we will be learning this technique, but that's a great point that you brought out, and a great observation. Okay. But yeah, I hate to say that it is not the right way. We develop some wrong patterns, and that is what happens. So we are going to be, hopefully by the end of the session, you will realize what the correct pattern is. So this slide just talks about the inhale and the exhale that I just explained. When you're inhaling, the diaphragm descends and goes down, and the pelvic floor, when I say pelvic floor lengthens, the pelvic floor opens up. It goes down also. And when you exhale, everything just returns back to the resting position. That is the normal synergy. That is what is supposed to be happening. All right. Now, going to the, I'm going to, all right, I'm going to pause my slide show here, because this would make more sense after I explain some things to you. So let me just get back to my screen. All right. Okay. So the talking part is done. And we're going to jump into some practical work now. All right. So what I would like you for you all to do, or I invite you to do, is 3 steps. Try to look at yourself. So either you could look into a mirror or your camera. You could change your focus into your camera and look at yourself, because I am not watching you. Nobody's judging you. This is the point where we are going to do a little bit of self-awareness and look at how we are breathing. Okay, so I'll give you a few seconds. I want you to look at yourself, and first step is to just breathe. Don't give yourself any other instruction. Just watch your breath. Okay, and when you've done that for 2 breaths, then I would like you all to try to take a deep breath. Whichever way you know to take it, don't change it just because I said something earlier, but just try to take a deep breath. This is just bringing awareness to your own body. Before we start changing anything, it's important that we become aware. So you guys can do this exercise. I'll give you a few seconds to do that. 2 breaths, looking at yourself and just doing it just like that. And then 2 deep breaths. And I'll wait. Let me know when you guys are ready. Ready? All right, perfect. So let me take a guess. Okay, I don't know. I haven't seen you guys breathe, right? But I'm gonna take a guess. When I asked you to not do anything and just breathe the way you were regularly breathing, you were probably breathing like this. And when I told you to take a deep breath, this is what I see in not even 99, but 100% of my patients. Okay, I tell them to take a deep breath at my assessment, And this is what they do. And you guys tell me if this is what you also did. Okay. Can you guys put in the comments if I was right or how you were breathing? You could describe it, or you could say, yes, that was the way. Yeah. Yeah. Feeling the air in the chest with the inhale. All right. All right. So, great. Thank you. Thank you for sharing your experiences. But here you go then. Okay. So what is happening is we have learned the pattern and wasn't even lifting the shoulders. Okay. Okay. So Shaiza said that she wasn't even lifting the shoulders. She was just trying to fill her chest in. So I'm assuming something like that, maybe. All right. But anyhow, so this is great awareness. This is the moment of truth, right? Now, your diaphragm that I just explained, that is the main muscle of breathing. All right. That's the main muscle of respiration. Your neck muscles, or your, these muscles, your shoulder muscles and your neck muscles, those are accessory muscles of breathing. And what that simply means is these muscles should turn on only when there is an extra need for oxygen. All right. So these muscles should ideally turn on only when either you're exercising, you're running, or you are at a higher altitude where you're not getting enough oxygen, or another very common time when this turns on is when we are stressed. Okay. What happens is in our society and in our lives, we are stressed all the time. Like stress is pretty much the middle name for everyone, unfortunately. And then we get into this pattern of just activating this. We forget the diaphragm. We forget our, when I say we're not doing this consciously. I'm talking about the pattern that we fall into. Okay. So what is happening is our body is not optimizing the big diaphragm muscle, which is supposed to do its job. So now the diaphragm is on vacation and all these tiny muscles are doing their best to take in a deep breath, going like that. Okay. So the first thing I'm going to teach you before we jump into the 360, the first thing, how I would like you to practice breathing when we are doing all these exercises and when you practice at home. So what you're going to do is you will try to keep your shoulders and neck muscles as relaxed as possible. That's number one. I invite you to take a breath through your nose and exhale through your mouth as if you're blowing candles. Okay. So please feel free to do it along with me. So deep breath through the nose and exhaling through your mouth. Now, one thing we want to remember is we are doing this whole activity to calm our nerves down. So the longer you exhale and the slower you exhale, the more effortless it is, the better we want, the better it is. So that's how we want. We do not want and blowing out candles. We don't want any effort in your face or anywhere in your body. Try to relax your body as much as possible. Deep breath in. And so this step is only about the actual breathing technique. I will be teaching you how to take the deep breath. And that is the main part. That's the hero section of our session today, the 360 breath. So you guys feel comfortable? We're going to move on to the next step. I usually teach the 360 breath in 4 steps. So the first step that we're going to do is abdominal breathing. All right. So you can sit in a nice relaxed position and place your hands on your belly. And as you inhale, let's try to expand our belly gently. We're not pushing anything out. We're gently expanding the belly. Now, for some of us who've fallen into the faulty patterns, this may seem counterintuitive. So until you get used to it, you just have to keep giving yourself the cues and try to follow this pattern. All right. So inhale into your belly, gentle expansion, and exhale through your mouth, blowing candles. Again, let's do 3 breaths like this. Inhale into the belly. Exhale. Inhale into the belly and exhale, blowing candles. All right, ladies. So how did that feel? Tell me what's going on in the chats, in the chat messages. Are you guys able to do it? Is it hard? Felt different? Yes. Yeah.
One more thing, Dr. Aparna. So yes, it felt different, but it also, like, I also still feel कि जब we are inhaling. So
Yeah.
when you said like it should go down, right?
Yeah.
I don't think I'm having that feeling when I'm inhaling. Like I feel that the air is going down.
So here's the thing. Diaphragm is a muscle that's inside our body. We're not going to feel it. We're not going to feel yeah, okay, good. Someone's saying that I'm a thyroid patient, but I still felt better. So so the thing is, you're not going to feel the diaphragm. What we want to try to feel is the breath not going up in our shoulders and just going down in your body. So if you're trying to sense that, oh, am I going to feel something? You're not. You should feel a gentle expansion in your belly, like just gently. And you should feel the relaxation in your shoulders, that you're not doing this anymore. You're breathing low in your body. You're just,
Definitely. So I didn't feel it here for sure in the shoulders.
Good, good. And as we do the other parts, you will understand a little bit more. Like you will feel it more in your body when we do the next steps. Okay. All right. Now the thing is, your diaphragm is like. I'm sorry.
Can I say one thing?
Yeah, of course. Yeah. Can you introduce yourself? I'm sorry, I'm not seeing. I'm not able to see anyone. Maybe the way I.
Her name is Prabha.
Oh yeah, hi Prabha. Yeah.
Another, I think, physiological reason is for a diaphragm movement. When you breathe, the lungs expand.
Yeah.
So it needs a space for a lung expansion. At the same time, when the lung expands, the diaphragm has to go down.
Yep.
And when you exhale, the lungs comes back to its normal size or collapse, whatever. Collapse is not the right word. And then there is extra space there so that the diaphragm comes up.
Yeah. Yeah, thank you. Thank you for sharing, Prabha. That's exactly what it is. So I was just explaining that. So the diaphragm is like a flap-like muscle that sits underneath your lungs, okay, right here. When you inhale, like Prabha explained, your lungs need space to expand, right? So the way the diaphragm works is it contracts by flattening down. It goes down. So your lungs have more room to fill up with air. When you're exhaling, the air comes out of the lungs and the space is compressed, and then the diaphragm kind of goes up to its resting position. So it's resting like this. With every inhale, it's going to go down. With the exhale, it's going to come up. Inhale, down, exhale, up. Okay, so we practiced the belly breath. We're going to go to the next step. And I'm sorry, I lost my thought. That's what I was trying to explain, that the diaphragm is a full flap. Okay, imagine that there's a rib cage. I don't have a model for that, but imagine there's a rib cage and the diaphragm is sitting at the bottom. The next thing that it not only goes down, but your rib cage also has to expand to allow the full excursion of the diaphragm, if that makes sense, right? So if it's a flap sitting on, sitting on at the bottom of your rib cage, for the diaphragm to move completely in all the directions, your rib cage has to expand nicely, right? Like an umbrella. So I even have an umbrella, but we will be doing, so I got an umbrella, but it's too big. Okay. Imagine, are you able to see?
Yes.
Yeah, me sitting
Yes,
under the
yes.
umbrella. So imagine that this is your rib cage, right? And your diaphragm is sitting at the bottom. When the rib cage expands completely, the diaphragm that's sitting at the bottom gets space to expand in all the corners, like in all the circumference. All right. All right. I wish I had a smaller umbrella, but I do not. So anyhow, so we're going to move on to the next step of the 360 breath. We're going to do the lateral rib expansion. All right. So lateral rib expansion. I'm sorry, Eamon.
There's like a small. Can you hear me?
I can. Now I can. Yeah.
Okay, there's a small concern that's raised in the chat as well. Whenever we breathe, we feel like whenever we take a deep breath, there's like an active pressure on our collarbone area here. Like it literally hurts. And a lot of people are saying that they feel something similar. Is that supposed to happen or something wrong?
No, I think I think that's because you're activating your neck muscles too much.
Okay.
Okay. Is this what you're talking about? You know, there's like a little vacuum here. Yeah. Yeah.
Yes.
That's because that's the only way we know to breathe. That is the reason.
May I tell something? And this is the feeling something like pinching underneath your collarbone.
Yeah.
Like a gas buildup, something like that.
Yeah. So I am assuming that is happening because you're really overusing your neck muscles. All right. Now, when we learn the 3 steps of 360 breath and we put it all together and we learn the actual 360 breath breathing, and when you practice that over a period of time, you will learn to optimize your diaphragm and actually breathe in the correct way so that these little muscles are not overworked, and hopefully that feeling will start resolving.
Thank you.
All right. So the next step is lateral expansion of the ribs. So basically in this, what we are trying to do is with every inhale, we want the ribs to move like a bucket handle. Okay. So we want the ribs to go up and down like this. All right. I'm going to place my hands here just to demonstrate. And then I also have another way, easier way for you guys to do it. So you'll watch my hands and I'll do it facing you guys, and then I'll turn around and do it also so you can see. So are you seeing the rib expansion? Yeah?
Yes.
Yes, yes. I can feel it as well, like if you place your hands on it.
Yeah, perfect. So I'll let you folks experiment with that a little bit, like, try to do it yourself. As soon as you give yourself a feedback and tell your body, all right, breathe into the hands now. Don't breathe here. Breathe into where the hands are. You're going to start feeling that expansion. So like that. All right. I do notice with my patients that when I tell them to put their hands here, their shoulders automatically rise a little, and I like to not. I like to not do that. So if you have a scarf, you can kind of wrap the scarf around your ribs, lower ribs. Make sure it's not around your waist. It's a little higher around your ribs, almost the level of your bra strap, since we are all ladies here. So, and now watch this, okay? Do you see that, folks?
Yes.
Yeah?
Yes,
Are you trying it? Is it working out for you?
it is.
Yes.
Okay, good.
Yes. Yes.
So that was the second step. All right. Now, the third step, it's not working out for Greystone. What is happening that it's not working?
Hi, I'm not feeling anything. Like I'm not able to expand it. I don't know.
You're
I'm
not
just,
able to expand it. Did you try placing your... Okay, what you could do is, do you have a scarf or you're using your hands?
I was using my hands.
Hands. Okay. So what you could do is when you're exhaling, just put a gentle pressure. Do not force, but just a gentle pressure on the exhale. Okay. So just to give you a little feedback. So exhale and then hold that pressure and see if you try to open your lungs against that gentle pressure, if that helps you.
Shoulders should not move.
No, the
Now it's
shoulders.
working.
Yeah.
Maybe.
So
I think it majorly depends on how much we exhale first.
yeah,
We have to
yes,
exhale much
yeah,
so that we have the capacity to inhale.
yeah. So the next inhale is going to be longer. And that is the reason why at the beginning, I teach you to exhale slowly and over a long period of time, because that lengthens your exhale, and then your next inhale is bound to be a little longer.
Okay. Yes, it's working for me now better.
Okay, good. All right. So then coming back to the third part. Now, this is the hardest part out of the three, but trust me, all my patients get it. So what I'm going to do is I'm going to demonstrate it like that. You will have to figure out a way to do this. Okay, I mean, I don't know what you will use. You can use pillows, or you can use cushions, or whatever it is that you have. But basically, what I would like you to do is curl your body over something so that your upper back is curved. All right. And now what will happen with this is your chest and your belly is kind of blocked with the ball or with whatever you're using to curl over. And then our body will get an opportunity to send the air in the back. Okay. So watch. And what you should feel when you're doing this is, as you inhale, your shoulder blades will start separating and you will feel an expansion here. You could also, there's so many ways of doing it. You could also do it like this. If you don't have something big, you could even go into this position like this. Take something small and go into a squat position if you can. Now I'm going to demonstrate it. I as close to the camera as possible. You should feel the expansion right here. Okay. So
Is using a pillow okay?
yes, absolutely. You could use anything. Are you able to see my back expand? Because I can feel it.
Yes, I can.
Okay. And why we're doing it is because your diaphragm, when it's a flap, in the front, it's connected to the ribs and the sternum. In the back, it is connected to your spine. So if we pay attention to this part as well, we are making sure that the entire diaphragm is moving and not just the front part.
Do we have to breathe in along with this posture?
Yes, so you'll go into that posture and you will take a deep breath in, just like we practiced the other two steps. And as you're breathing in, you will notice that the breath, you want the breath to go here and this part expand.
Okay.
Okay, so let me show you here like this also. So I don't want you all to do this. I'm just showing you how the expansion happens. You see my fingers spread out?
Yes.
Yeah.
Yeah. So that is what should be happening. This is kind of hard. Just like we used hands for feedback here, the best feedback we can give for back breath expansion is rounding your back. As soon as you round your back and you breathe, you can start feeling this part expanding and your shoulder blades separating. That's what you ideally should feel. And this, ladies, I'm teaching you this, but just also know that there's a lot of more steps involved, right? I am teaching you to do this, but somebody that has a lot of tightness or a lot of stiffness in their ribs or their upper thoracic spine may not be able to do all this, right? So there's a lot of other exercises, there's a lot of other follow-ups that need to be done so that people can do what I'm asking them to do. But this is more of an awareness session that at least we can do the best we can. Okay, so my point is that you may not be able to do all this perfectly right away because you guys are still learning and there might be some restrictions in your body that may not allow you to move the way I'm asking you to move. But over a period of time, when you practice, when you do exercises to really give you more mobility in your in your thoracic spine or your rib cage, then it becomes easier and easier. Is everyone good? Can we move on to the next step?
Yes.
Yeah. So we did the 3 steps: the belly expanding gently on the inhale, the ribs coming out like a bucket handle on the inhale, and then the back expansion on the inhale. On the exhale, we're not trying to bring anything back to its place. The exhale needs to be very passive and everything just recoils to its resting position. All right. Now, the 4th step that we're going to do is actually putting these 3 steps together. All right. So you can take feedback wherever you feel the most need. So you can place your hand on your belly, you can place one hand on your belly and one hand on the ribs, or you could do a little bit of a curl to get the feedback into your back, whichever place. Sometimes my patients I just tell them, just breathe the way, imagine that you're breathing 360 breath and place your hands here, because they're still not getting into the pattern, out of that pattern of using the shoulders. So just placing your hand on the shoulder to calm down the shoulder, to just relax the shoulder, can also help. It can also help if you sit in front of a mirror so that this part is taken care of. The mirror will tell you, oh, don't like, you're picking up your shoulders, keep the shoulders low. That helps too. Now, one cue that I have found very helpful is to imagine that there's a balloon. There's a balloon right here. Okay. And what you want to do is as you inhale, imagine that the balloon is blowing up. Okay. The balloon is lower down. It's not in your shoulders. It's lower down in your body. So imagine that you're inhaling, and with every inhale, the balloon is expanding. So your belly expands. Since we are also working on pelvic floor lengthening, we can also think about that as we inhale, the pelvic floor expands or lengthens. We're creating space in this area, right? And on the exhale, everything just returns back to the resting position. So inhale, 360 breath. Exhale. Inhale.
And right now we are exhaling through the mouth, right?
Yes, yes. Just like we did in the beginning. So inhale. Exhale. Actually, ladies, I'm going to take one step back and teach you another step also. So on the inhale, we learned that the diaphragm and the pelvic floor both go down, right? So let's talk for a moment about how to get that in your pelvic floor. All right. I got a model this time to show you. This is the model of a female pelvis. All right. And this part that you see in red is the pelvic floor. So pelvic floor is 3 layers of muscles and a lot of other connective tissue, blood vessels, nerves, everything mashed up together into 3 layers, which sits at the bottom of your pelvis. Bottom of your pelvis right here, like this. Okay. It almost forms like a trampoline. Your diaphragm is up here. Your pelvic floor is here, and in between are all your organs. All right. Now, this is what we want. On the inhale, exhale, up. I am moving my whole hand. That doesn't mean that your whole pelvis is moving, ladies. I don't have a better way of doing this. But basically, when my lower hand is moving, imagine that only this part is expanding and moving down. And the cues that you can use to actually let the pelvic floor drop is imagining that your whole pelvic floor is, your vagina is blooming like a flower or opening up like a jellyfish. And that you want to try to do on the inhale, okay? Because inhale opens and goes down, exhale returns back to the resting position. Inhale opens and goes down, exhale returns back to the resting position. All right? So let's give you a moment to synthesize everything. And I will cue you through it. So again, you may place your hand wherever you feel you need the most cueing. If you realize when you were practicing that rib expansion was hard for you, place your hands here. If belly breathing was hard, you can place it on the belly. If back expansion was hard, you can curl a little and try to make a connection with your body and feel the expansion in your back. All right. And then 4th step, we are trying to put all this together while also lengthening the pelvic floor. Okay. So let's do 5 breaths together, and I'll just cue you through it. So inhale. And as you're inhaling, your belly comes out gently. Your lateral ribs expand. And breath goes into the back, pelvic floor goes down. As you exhale, everything gently returns back to the resting position. Inhale, opening up like an umbrella, pelvic floor going down and lengthening. Exhale, everything returns back to the resting position. Inhale, open up like an umbrella. Exhale, back to the resting position. Inhale, nice opening. Exhale, back to resting position. And one more deep breath. Keep your shoulders low. Inhale like an umbrella. Exhale, return to the resting position. All right. So tell me in the chat, how are you feeling? At least are you feeling like you learned how to do it, and now it really depends on how much you guys practice it. Okay, it really depends on, this needs a lot of practice. If this could be changed in an hour, this world would be very different, right? So anything that we learn, we just have to practice it on a daily basis so that we get better at it. And then initially we have to give ourselves feedback. We have to pay attention, but slowly but surely, your body learns to breathe in this way. So whenever you sit down for breathing exercises, it will automatically start doing it the way you train it to. All right.
So that's how we should normally breathe as well.
Okay,
Which
no,
we-
yes, yeah, I know that question was going to come, and my patients actually go a step ahead. They will ask me, do you breathe like that all the time? And I'm like, they really put me on a spot. So that is ideal, right? That is ideal. But we are not sitting on the Himalayas and meditating all day long. We have a life to lead. We have our daily chores. We have responsibilities. We have stresses. All that will affect your breathing. Okay. So honestly, I don't expect, or I don't think there's anybody that does this kind of breathing 24/7. That is not happening. That is too idealistic and wishful thinking. I would love for everyone to do that, but that is not happening in reality. But having said that, if you can spend 15 minutes of your day breathing like this, you will see a huge change in your pain levels. You will see a huge change in your overall health. You will see a change in your mental health. And breathing, we only spoke about how breathing helps in endo and chronic pain, but honestly, breathing has tons of other advantages or physiological benefits that we haven't even spoken about. Breathing can actually help decrease the overall inflammation in your body. It helps in so many other conditions like autoimmune conditions, allergies, you name it, and breathing is the tool. So it can only be helpful even if you do it for 15 minutes in a day, or you take 5-minute breaks throughout the day, maybe 2 or 3 times, and do it that way. I think it would be super duper beneficial for anyone.
Definitely, I think. And also, would it help with, like, definitely if breathing is helping with the pelvic floor muscles, it definitely is helping with any condition that is associated with pelvic floor, I'm assuming.
Absolutely. I mean, I have been mentioning endo because this is a support group for endo, but like I said, every single patient that comes in to my clinic whether they're male or female, or they're there for incontinence, or they're there for chronic pelvic pain, or anything like that. I start with the breath. Another important thing, Natasha, it's not related to endo. I mean, in a way it is, but your diaphragm and pelvic floor both are also part of your core. So even if a person doesn't have any pain, they're coming to me just for, let's say, core weakness, or after, yes, absolutely, back pain, right? Back pain, in most patients with back pain, they will have a weak core. So if we have to strengthen the core, your pelvic floor and your diaphragm are two most important structures that form your core. So breathing in this way is extremely beneficial as a starting point for anybody with pelvic floor dysfunction. It's not just for pain or not just for endo.
Okay. Is there anyone, Dr. Aparna, who should not be doing 360-degree breathing, or like would cause them harm in any way?
Yeah, that's a great question. The only thing that comes to my mind is somebody that has a rib fracture and it's extremely painful for them. In a way, once the rib fracture starts healing, it actually helps to regain the normal mobility in the rib cage. But that's in the later stages. If someone has a rib fracture early on, it might be extremely painful to actually expand and get that much movement. Body will do its own with due respect, body will try to guard that part and not allow that much mobility. So that will be painful. Other than that, nope. Certain like I showed you, to do this when you are trying to perceive the back breath expansion, that is obviously not advisable in pregnant women, right? Like they'll have such a big tummy and they're trying to crouch onto something, might be super duper uncomfortable. But there are other ways. When pregnant women come to me, 360 breath is so important for them, so important, especially as the fetus grows and their posture and body changes, extremely important. So I modify these. Right now, I just gave you all the basic steps to even understand what 360 breath is. But like I said, there's a lot of work to it. There's a lot of work to be done sometimes I have to modify it. Sometimes I have to work on rib cage mobility. I do hands-on techniques to get their ribs and their upper back working. So it's not so simplistic, but this is a good starting point for everyone. And I can mention, I have to drop in about 15 minutes now, but I do have to mention, I have a slide. I was hoping that we would get time to do this, but unfortunately, we are running out of time, but I'm going to show you guys something. Give me a second, please. So, do you guys see the slide?
Yes, we can see that.
Yeah. So this slide shows some very basic yoga poses. All right. So the first one is happy baby. The second one is child's pose. This is cat cow. Have you done any of this before? Yeah, these are very common yoga poses. I wouldn't be teaching anything like astronomically different if I practice this. But what I would suggest is, once you have practiced the 360 breath, and you come to a point where you don't need these feedback, like placing your hand anywhere. You don't need this. And you're able to do the fourth step that we practice of really expanding and breathing low. You can use any of or all of these poses, go in this pose and practice the 360 breath. These poses are mostly hip opener poses or abdominal stretching poses, which are super effective for endo patients or any kind of pelvic pain patients. All right. Obviously, we didn't get to practice this, so we couldn't go into the details of it. You have to be mindful of your own condition. This is very general advice, right? So, so in some people, some poses may be contraindicated, but this is, if you don't have any other contraindications, these poses are great to get that overall relaxation in your body while practicing the 360 breath. If you guys want to take a picture of it, feel free to take a picture of it. I just made it myself. So this screen, I just call them global stretches. They're really good stretches for endo patients.
Perfect. I've taken a screenshot as well. We'll share this in the group.
Sure.
Thank you. Yes.
Sure. All right, folks. Can I stop sharing the? Yeah. Okay.
Can.
All right. So just winding this whole thing up, right? This exercise is not to. It's not to make anything perfect, okay? Because like we discussed, that's going to be unrealistic. That every single breath we take in our life, it's going to be like a 360 breath. But yes, Greystone, yes, I will. But yeah, the purpose of teaching you this is, if you guys can take away one main thing, that when someone asks you to take a deep breath, do not breathe like this, and breathe low down in your body. Try to expand your ribs as much as possible. Try to get that movement of the diaphragm. You will make me really proud, and I will feel like this was worth it, spending my time with you all. Okay, so it's not about perfection, but it's more about knowing what is right and practicing, and you will see the magic of breathing and the 360 breath, how it will help you. It's transformative in a lot of my patients, that it helps to really bring down that alarm system in the body, and it really helps to calm down your nervous system. Your pain perception will go down. Are we going to cure endo with this? Absolutely not. That's not happening. And that is not nobody's claim, or that is not the purpose. But how your body perceives that pain, or how your body deals with that endo process happening in your body, will change quite a bit, and that will make a big difference to your overall well-being.
Perfect. So
Okay.
I'll
think,
just if you can do because I know you have to leave in 10 minutes.
Yeah.
So, and then we'll just conclude the session.
Yeah. So I think someone in the group chat asked me to demonstrate the deep squat position. It's called Malasana in yoga, Malasana or sumo squat. So what you're going to do is you are going to go into a deep squat like that. Now you will see that my heels are not touching down like that, right? I don't have the flexibility. So in that case, if your heels touch down, that's great. If not, what I recommend doing is either roll up a yoga mat or like a towel and place it underneath your heels like that. Okay. And then you go into a prayer position and use your elbows to gently open up your knees. We're not pushing, we're not doing anything extreme, but we're gently opening up the knees. I'm going to show you sideways as well, because it's important that we are not doing this. Okay, we still have to be upright with a little bit of a curve maintained in our lower back so that we don't mess our backs. And then we just stay in that position. I recommend about 2 minutes or so trying to do that deep breathing, the 360. Like that.
Perfect. I think the back needs to be straight and
Yeah.
heels need to touch. And if it's you give
important that you don't just like slouch when you're doing that. Okay, that's why I showed it to you from the side. That's an important thing. All right, one more thing. We didn't get a chance to practice all those poses, but one general instruction that I give all my patients, that if you're trying to get into a pose, right? Let's say either reclined butterfly or you're trying to get into the child's pose, whichever pose it is, right? One, if your intention is to do the breathing and relax your body and your pelvic floor, you want to make sure that your whole body is supported. Okay, so to give you an example, quick example is I'm gonna show you how we do the reclined butterfly. So you lay down like this, right? And get something for your neck and bring your heels together, right? And your knees fall down. Now, when you're doing this, though, it's important that you take a support for your knees and don't do it just like that. Okay? Because what happens is, if any part of your body is unsupported, and if any part of your body is tense, your pelvic floor is not going to be able to relax. And for endo patients, that is one of the main goals, to be able to lengthen and relax the pelvic floor so that the tension in that area decreases, right? So anytime you do those poses, you just want to make sure that the rest of your body is supported. Take support wherever you need. If you need it in underneath your elbows, do that. If you need underneath your neck, do that. Your body has to be supported and relaxed so that you can open up your pelvic floor on the inhales when you do the 360.
perfect.
Right.
Yeah. So I think let's just close the whole session. And thank you so much once again, Dr. Aparna. And thank you so much to your clinic as well, Prana Pelvi Thrive as well, for supporting She Deserves Care, for supporting all these women who do need help.
Yeah.
So once again, just to let all the audience know, this session was arranged by She Deserves Care. I'm the founder of She Deserves Care, and Eamon over here is the co-founder of She Deserves Care. And Dr. Aparna is our connection to our pelvic floor muscles. And thank you so much. Thank you so much once again. This is the second session we are doing with you. And I don't think I can be more thankful to you, and She Deserves Care can be more thankful to you for giving us your time, for your special time to us, and helping us figure out how to breathe. And I'm sure it should be a stepping stone for us. It's not everything, like you mentioned, but it's a stepping stone. Yeah, it's a starting point to understand that breathing and pelvic floor muscles, and probably later on massages, all of these are very important for the rehabilitation, if not the cure, but definitely for the rehabilitation.
Yeah. Thank you so much. Can I please request all the attendees to please follow my Insta account? I would really appreciate that. I just put it in the chat. It's Prana Pelvic Thrive. And I do put out a lot of information out there, whenever I get time. I'm posting stuff, trying to create awareness. Awareness is something that really lacks in this field, like you guys know. So I'm trying to do that. If you want me to share anything specific going forward, feel free to comment on my posts and tell me, hey, can you do a video about this, or can you do a reel about this? And I'll be more than happy to do that. And if you, apart from this, if you have any other questions, feel free to DM me on Insta. I'm pretty active. I will respond at least in a day or two, if not earlier. And I'm happy to help out and answer any questions or go over anything via DM as well.
Thank you, Dr. Aparna. Safe to say on everybody's behalf that we really learned quite a few things that we were doing wrong. So thank you for your time.
Thank you, and thank you for doing the good work of sharing this information with the world.
Have a good day.
Yeah,
Thank you
too.
for joining as well.
Thank you. Bye.
Thank you. Bye.